name's Stevie Robinson. I'm the host. I work for ABL Health. We've got Chris with us today and Saba from More Life. I'll hand over to Chris, and Chris is going to talk about all things dietetics today. All right, thanks, Chris.
Thank you very much. My name's Chris. I'm the dietitian on the team at Salford Royal. So I've been asked to come and talk today. I thought I'd just do a little bit about preparing for surgery and then answer some of the commonly asked questions towards the end as well. So in preparation for surgery, obviously you're doing your time with More Life or Choose to Change or with ourselves at Salford, and you come in for these education sessions and getting yourself prepared in terms of weight loss and things. So definitely keep going with that. Once you come and see us, you'll see the surgeon, the medic and nurse dietitian, have some further education and more conversations about which operation is suitable for you. And once you then get a date for surgery, which may be quite some time in the future, unfortunately, you will be started on this liver reduction diet. So the liver reduction diet does exactly what it says on the tin. Shrinks the size of your liver. So the liver is the big organ that sits in front of the stomach there, and making the stomach smaller just gives a better view for the surgeon. So it just makes it a little bit safer. So it's better for you if you follow this really well for those 2 weeks. So don't follow the liver reduction diet after the operation, and stick to it for two weeks. The surgeon might ask you to follow it for a little bit longer if you're a little bit bigger around the middle. They like to have a good view of the stomach, and we know that it's not just liver size that reduces, but body fat as well. So it makes the operation that little bit easier. So we know by following the liver reduction diet that this low energy, low carbohydrate diet effectively shrinks the left lobe of the liver, so it moves out of the way of the stomach. So just make sure that the surgeon can see that liver a little bit easier, and makes the operation safer, like I said before. So this is a liver reduction diet that you're going to be following. So we ask patients to follow a very low carbohydrate, low calorie diet. You can have 3 portions of carbohydrate per day, or 1 portion 3 times per day. Try not to save it up for any one meal. Spread it out through the day if you can. You can have 2 portions of protein, 2 of dairy, 2 of fruit, and unlimited non-starchy vegetables and salad to really make yourself feel full. So then there's an example on the screen there for you to look at, and we'll also give you examples and what 1 portion of each of those food groups consists of. So really important that you do follow that strictly for at least 2 weeks prior to your operation, maybe more if needed. Some people ask, can we do the milk and yogurt diet or the meal replacement diet? And yes, in theory you can. They still work by reducing your calories and reducing your carbohydrate intake. The reason why we prefer this low calorie food based option is because it gets you into good habits for after surgery by eating regularly and planning your meals. But also it gives you a little bit of real food and solid food and fiber. So it's going to help with your bowel movements after the operation. If you're on a liquid diet or a meal replacement diet for 2 weeks prior to the operation, and then you have the recovery diet afterwards, where you're going to be on liquids for a little while, then you're going to be on liquids for quite a long time, and that's not really good for anybody's guts or sanity. I don't think I would wish that on anybody, but some people want to do it, and that is okay. That's your choice, but this is the one that we would advise. So very small portions of carbohydrates spread through the day, a couple of portions of protein, lots of vegetables and salad to keep yourself feeling full. And that's one thing that I would say, is make sure that you utilize those vegetables and salad to bulk out your meals and make yourself feel full. On top of that, do try and drink plenty of low calorie fluids. I know we're trying to shrink the liver, and it does that by reducing water in the liver and the muscle cells, but it's really important that you drink plenty of low calorie fluid to keep yourself hydrated. A note of caution for the liver reduction diet is that if you take any medications for your diabetes that reduce your blood sugars, so certain drugs including insulin, for example, you would need to have a chat with us first or your diabetes nurse to adjust either the dose of your insulin or the other medication. If you have kidney problems that require you to have reductions in your fruits, vegetables, or dairy or protein, then you need to let us know and we can come up with a suitable alternative. But other than that, you should be okay to follow the liver reduction diet. But any problems or anything like that along the way, you can contact us. After the operation, we put you on a recovery diet for 2 to 3 weeks on each stage of liquids, puree, and soft. And this is basically just to make sure that you recover really well, get used to eating food again without making you sick. So gradual progression through the stages. Don't rush. If you are struggling at week 2, please kind of go on for another week on that stage until you feel ready to move on to the next stage. So yeah, 2 to 3 weeks on each stage, and you've got a different operations on there. Bands we don't do so much anymore. I'm sure you've heard from surgeons in the past on this channel that we don't do bands very much anymore. We take out far more than we put in. Most common are the sleeve and the two different types of bypass. So regardless of either of the two types of bypass or the sleeve, you'll be following the same recovery diet. So your liquids start on day 1 after surgery. So you're talking 30 mils of water to sip per hour until the team are happy with you. Then you can move on to sips of free fluids, including squash and tea and coffee and milk. And then you move on to a normal liquid diet where you'd be having fortified milky drinks, you'd be having smoothies, you'd be having protein shakes, soups, etc. And there's an example day on the right hand side there for what you might be looking at. You're aiming for at least 2 liters in total per day, or 1.5 to 2 liters. But that includes all of your liquids, including the soups and smoothies and protein shakes and water. Make sure that you take really small sips frequently and avoid anything that's too fizzy. And we ask you to avoid alcohol for 6 months after your operation as well. So no alcohol and no fizz. The next stage is puree. And this is kind of the stage where you're introducing food in small amounts without making you feel sick. It should be nice and smooth, like baby food. And you don't have to have a pureed meal at each meal, as long as you're having some puree, just to get your body used to introducing a new texture. You're learning the way your stomach, your new pouch works, and what will work for you and what won't, what will go down and what may make you sick, and learning your eating habits. So really important that you have these smooth consistencies in small portions spread throughout the day. And again, there's an example meal plan on the screen there that you can see, and this is all in the written information that you'll get as well. When you start in the puree, just make sure that you really practice those eating habits that we're going to talk about in a second. So even though the puree stage doesn't really need chewing as such, please still do so to practice. If you put too much in your mouth, even of the puree, you'll end up being sick. So it's really important that you take small bites, you chew well, you separate your eating and drinking, and you stop when you've had enough. The next stage is a soft diet. So this is the soft fork mashable stage. And again, 2 to 3 weeks on this stage. Similar kind of foods, but you don't need to blend them down anymore. So again, moving through different levels of building up the textures, as you can see on the screen there. So after 2 to 3 weeks on the soft stage, gradually building up textures, you'll be back to full normal diet. So within 8 to 12 weeks, you should be back to normal consistencies in very small portions. So we want you to be eating healthily with small portions, planning to have your meals and snacks regularly throughout the day on small plates, making sure that you get the right kind of balance and consistencies at your meals, using lots of crunchy, solid, challenging textures to keep your portions small, focusing on the protein and the vegetables and things like that at your meal times, and keeping the carbohydrate intake small, remembering your eating habits, obviously. And at this stage, really important to note that it's the quality of the food that you're looking for, not the quantity. So make sure that your food is nutritious and healthy and balanced, plenty of color, plenty of fiber, plenty of protein, and that should help to make sure that your weight loss continues, your weight doesn't go back up, and you're feeling satisfied from your meals. So there's an example plan of a normal day, what it might look like. So you can see there's 3 meals and a few sensible snacks throughout the day. On top of that, you need to be drinking plenty of low-calorie fluids again, and ensuring that you separate your eating and drinking. Eating habits, really, really important. I can't stress enough how much that I would kind of recommend that you practice the eating habits prior to having bariatric surgery. It's a shock to a lot of people how much you have to chew things and how slow you have to eat, and the change in your approach to food. So do develop it early on, start from now, practice your eating habits. So we have this rule of 20. So 20 pence piece sized bite, chew it 20 times, put your knife and fork down for 20 seconds, stop after 20 minutes. So it's really small bites, you chew it thoroughly, you have a break in between each bite, and you don't eat for more than 20 minutes. And that just gives your body a chance to kind of digest the food, let it go into your new pouch and through into your small intestine without causing you any discomfort or end up being sick. So really important. Also to separate your eating and drinking, maybe 20 minutes before, 20 minutes after, aim for that and see how you get on. Other things on there: stop when you've had enough, and don't return to leftover food. So that's a predictor of weight regain, which we will come on to later on. So a brief overview of the liver reduction diet and then the post-op recovery. And then once you're back to normal foods, you can start the supplement regime. So you are going to be on a complete multivitamin and mineral supplement, some iron, some B12, calcium and vitamin D, and the folic acid is already in the multivitamin. You may need extra, but you will be taking some supplements for life. And these are to prevent deficiencies rather than to treat anything. If you are low in anything at any point, then we can give you some extra advice, or write to your GP for their input and increasing or decreasing the dose of the supplements. These are the vitamins and minerals normally are contained in your multivitamin, but some people do have low levels further down the line, so we just recommend routine monitoring annually via either your GP or via our medical weight management service. So I hope that has been useful from a brief kind of overview of the diet before and afterwards. I can see there's a fair few questions on the chat, but we'll get to them later. But I thought I would answer a couple of the commonly asked questions that come in. And one of the most common ones is, how much protein do I need to consume? And that is it's a difficult question to answer, because we work it out in grams per kilogram of ideal body weight. So as you can imagine, that's different for everybody, and it's really quite difficult to achieve. However, our guidelines, they've started from America, but the British Obesity Metabolic Surgery Society also support the 60 to 80 grams of protein per day. So anywhere in that target would be ideal. Gentlemen probably need a little bit more than that, a minimum of 80 up to kind of 90. That's what we're aiming for. Like I said before, it is quite difficult to achieve, especially as some people have intolerances to meat and fish, or they're vegetarian, they struggle with dairy products, etc. So it can be quite challenging to meet that 60 to 80 gram per day target. So a lot of people do ask if I consider protein supplements a good option. Now, I never used to, but I think they are becoming more available, a lot cheaper, more tasty, and less additives in there from over my career. So I think they are a good option. So there are lots of good sources of protein. So there's some examples there of when you're on the liquids, when you're on the puree, when you're on soft, and then the same kind of foods when you're back to normal. So yes, we first line is to use the milk and the milk powder because it's probably the cheapest way of getting your protein in. A pint of milk with 4 tablespoons of milk powder added will give you about 40 grams of protein. So that's equivalent of around 2 protein shakes, something like that. If you drink that through the day, it's kind of 2/3 to half of what you need, and then you can add high protein soups or high protein smoothies or another protein shake throughout the day. Yeah, definitely protein shakes, protein waters are more common, and I've got no problems with you using them as long as they're no added sugar and there's no other additives that you don't necessarily need. So it should just be a plain whey protein or a whey protein water. So I hope that answers that question. One more thing to add on that is that with time, I would like you to come off the protein shakes and protein waters and anything that's too liquid in terms of protein. In the long term, I want you to be getting your protein from solid food rather than from liquids, and that's going to help to keep you feel full, and that will help with long-term weight loss and weight maintenance and preventing weight regain, which we're going to come on to shortly. Leading on from that is how many calories do I need to consume? And again, this is worked out using gender, age, height, and weight. So it's different for every single patient. And if I work out everybody's calorie requirements after surgery, nobody meets them. So your calorie needs are way higher than anything that you're going to achieve. So that's why we don't kind of recommend a calorie target to start with, because some people are, really low and building up gradually. Other people are a little bit higher and can manage a little bit more. So from my experience, the calorie intake in the first few weeks after surgery is vastly different from person to person, depending on their nausea, their food choices, their taste changes, how they're getting on, with medications. It's very, very different. So I don't really like setting calorie targets because I don't want to unnecessarily worry people. I would rather have one-to-one conversations with patients and give them the support that they need from that perspective. So instead of focusing on the calorie intake, what I ask patients to focus on, these are the patients maybe a little bit further down the line when they're recovered from their operation and they're 3+ months onwards, is to focus on the basic principles of bariatric nutrition. And what I mean by that is making sure that you eat regularly. So having your 3 meals per day and maybe 2 to 3 snacks if needed. You might need to plan ahead to achieve that, make a menu at the weekend and do your shopping. That will all help with that. So definitely regular eating pattern does help. Patients that skip meals aren't going to be getting enough calories. So in effect, that might be leading to too much weight loss, or it might lead to a stall, because often when patients don't eat enough calories, they consume more later on, and actually they're tired, they're more tired, so they move less, they're more hungry, so they snack more. So yeah, to make sure that you eat regularly. Prioritize your protein, so looking at 1/4 to 1/3 of your plate covered in protein. So whether that be from meat, fish, corn, pulses, eggs, all those good sources of protein. Make sure each of your meals has a good source. Make sure you're getting plenty of vegetables, so 3 or more portions of vegetables and a couple of portions of fruit. Looking at covering about half of your plate with veggies or salad. So getting plenty of fiber and plenty of crunch and plenty of colour. And if you can still manage a little bit more, you can have small portions of low glycemic index carbohydrates. So what I mean by that is things like whole grain pasta, whole grain rice, if you can tolerate it. Things like sweet potatoes with the skin, white potatoes with the skin, all those are really good low GI carbs to include, but obviously in small portions. Like I said before, try choosing solid, challenging textures to keep that portion small. We know that soft foods can be eaten in bigger portions and can lead to weight regain. So making sure that you can focus on more solid, challenging things, and drink plenty of low-calorie fluids. and avoid grazing, which we'll come on to in a minute. So although I know I've said that I don't really like to give calorie targets, some people really do like to have that there. So as a guide, that initial recovery diet, you're aiming for 600 to 800 calories. In the first year, you're probably between 800 and 1200. And then in the longer term, it's 12 to 15, but some people do go a little bit higher than that. And as we'll see, some people actually go a lot higher than that. So I hope that helps to clarify, the calorie targets and why we don't really set them, and why the other things are more important than just focusing on the calories. I do find that if patients meet their protein requirements, they meet their fruit, vegetables, and salad, they're getting plenty of low GI carbohydrates and some dairy products. If they're doing that and they're eating regularly, they're not going to be exceeding their calorie intake. They can't be. They're going to be too full. So yeah, hopefully that helps. So weight regain after surgery. So we now know that weight regain is actually expected after bariatric surgery. So, but only a small amount. So about 70% of patients will reduce their weight by their 60 or 70% of excess, whichever operation they choose to have, and then they will kind of regain a little bit and then stabilize, and they will stay there for the long term. So that's what we're aiming for. So don't panic if your weight goes up a little bit and then stabilizes. That's to be expected. That's your body just settle into its new normal pattern. So yeah, don't worry about that. That's what we're aiming for. I often find patients that do get to that point and stabilize, they often want to lose another stone or two, but I advise them just to aim for stability and think of other non-scale benefits. So don't just focus on the number on the scales, but focus on other things that will keep you motivated. I find that people that get to there, that really push themselves to lose that extra stone or two, they become despondent. So they because their calorie intake is too low, they become tired, fatigued, they don't want to exercise, they become more hungry, and then they end up putting the weight back on. That despondency just creep in, and then sometimes the weight goes up even further. So once you're at that plateau, I would advise you to kind of aim for stability. Unfortunately, 20% of patients may gain a significant amount. So they lose weight and they come back up, but not gaining all of it. So they've still got some benefit from the surgery. And unfortunately, 10% of patients may regain all of their weight, or not lose enough weight initially. But it's difficult to tell who's going to lose what and who's going to regain what and why. But the reasons why people regain weight after bariatric surgery are the same as the causes of bariatric obesity in the first place. Sorry. So we know there's lots of causes of obesity, from kind of education and environmental factors, social factors, lots of things going on that cause this chronic condition. And we know it's a chronic condition. So we know that bariatric surgery doesn't cure obesity, but it's a tool to help kind of control it. And unfortunately, some patients, it's not effective, and weight goes back on. So there's lots of things there that can go back on. So you might start on a new medication, you might develop a new illness, something might go on in your social life. You might end up working nights, and that affects your dietary patterns and your sleeping habits, etc. So you've got to look at this as a whole. Do you need to change, your job, for example? Do you need to look at other forms of employment? Do you need to kind of get new support from different family members, etc.? But from a dietary perspective, there are real kind of things that stand out from my experience of patients that are regaining weight, and I've listed them there. So eating patterns, like I said before, patients that don't eat regularly end up putting weight back on because they can go back into old habits of over restriction and overeating, and that can lead to weight regain. So getting into a good habit of eating regularly early on is a really good baseline. getting the right balance at your meal times, like we said before, about focusing on the protein, getting lots of vegetables and salad and small portions of low GI carbohydrates, and looking at the food texture and the food quality. So rather than going for soft, sloppy slider options that are going to leave you feeling quite hungry quite soon after you've eaten, or they can be eaten in bigger portions, we want you to be looking at more kind of healthy, balanced, challenging, fibrous foods to keep those portions small. Some people have too much energy from liquids, so they might drink a couple of liters of milk. They might have sugary fizzy drinks. It might be a liter of pineapple juice. Just trying to think of some of the things that I've come across. Alcohol intake might increase as well. So all this energy from liquids that are going to just slip by the operation and not make you feel full, and just create an excess of energy, and your weight goes up. Grazing is probably one of the biggest predictors of weight regain. So that, what I mean by grazing is continuously nibbling. So although we want you to be eating regularly through the day, we do want you to have defined meals and snacks. So what I mean by that is, if you're having a snack in between your meal of, say, an apple and some peanut butter, then I would like you to eat that over 15 to 20 minutes and stop when you've had enough. So you might be able to manage half of the apple and a tablespoon of peanut butter, and that would be you finished. Grazing, on the other hand, would be kind of picking at a fruit bowl over the morning, or going for biscuits dumped in tea that you can just kind of keep going back to, nibbling on things like nuts from a packet rather than just having a measured portion, or even going back to meals afterwards. So having a couple of mouthfuls, doing something, then going back to it later, having a couple more mouthfuls, stopping and going back to it, and kind of stretching it out over maybe an hour or two. So you've eaten the same portion, but kind of spread it out over a longer period. And also head hunger, comfort eating, boredom eating. These things don't go away after surgery unless you really put the effort in to manage them. So definitely go to the food and mood groups with your kind of tier 3 or weight management provider, and that would help. But there's lots of things that we can help you with in terms of that in the long term. And you're not alone in any of these things. The number of times that we come across these dietary patterns creeping in, it is quite frequent. So we do have support groups and things that you can access afterwards. But talking about preventing regain, this is where those dietary habits really come in very very important. And you've got to use the surgery as a tool to help you develop these healthy habits from the start. So the meal planning, the textures, the healthy, well-balanced meals, the healthy snacks in between, the not grazing, the avoiding comfort eating at night, things like maybe doing some exercise if you're particularly stressed and you're a comfort eater, things like that. You've got to start those early on and carry on as you mean to go on. Start as you mean to go on, sorry. And I've put in there just to follow the basics like we've already gone through today: regular eating, good quality nutrition, avoid the sliders and the grazing, but allow occasional indulgences. So still allow yourself to have a treat on occasion. That's absolutely fine. That's normal, healthy eating and human behavior. So that's absolutely fine. It just can't be a regular thing. Developing new relationships with food, in terms of eating habits and shopping habits, and the way you approach your nutrition plan for yourself and your family. We see real benefits across the whole family from these operations, from learning about portion sizes to healthy eating to regular eating patterns, etc. So if you can get your children involved and work on it together, that would help the next generation as well. So yeah, think outside of the box and how it can help everybody. Another thing to help prevent regain is to set some goals. So set some goals, but think of non-scale goals, non-scale benefits. So not just, I want to be 10 stone by this time next year. Sure, that's a good goal to have if that's something that you want to achieve, but thinking of other things. So maybe going on a roller coaster or going on an airplane without the extension seatbelt, or anything like that really. So some non-scale benefits, maybe doing a 5K walk or climbing a mountain, or something other than just getting on the scales and seeing what you weigh from day to day. Do attend our follow-up. So please, if you get missed for whatever reason, you still want to come for follow-up, then please do give us a call and let us know. We don't miss anybody on purpose. So if we don't offer you an appointment, then please do get in touch and attend your follow-ups. If you notice that you're regaining weight, then please get in touch even quicker. So it's easier to put things right early on rather than leaving it too late. Don't be embarrassed. It's not something to be embarrassed about. We know that, I said before, obesity is a chronic condition that does relapse. So it does happen, and we know that. So do seek help early and be honest with yourself about the reasons why you're gaining weight. If you're honest with yourself and you're honest with us, we can help you. And also seek support outside of the follow-up team. So friends, family. There's lots of things on social media that I'm sure that you're all aware of or involved in. I try and stay away from it, but yeah, there's lots of things on social media, and obviously we have our own support groups just like this one. We have one for after the operation as well, so they're just starting back face to face. This was taken in 2018, so way before the pandemic, and obviously you can see that it was very busy, very popular. But this was for patients that were pre and post, but the majority of these patients are pre-surgery. But we are going to be going back to doing some face-to-face post-surgery sessions. So please do come along to those after your operation. I can see that there are plenty of questions in the chat, which is great. I'm going to stop sharing my screen and invite Stevie back to read some of those questions out.
Brilliant. Thanks for that, Chris. Well, we've got lots of questions. I'm sure you've seen some of them coming through. Yeah, there's lots of them. Sabra and I have been trying to work through some of them in the background. I'll just say there's lots of questions about the waiting list, and this probably isn't the right forum for us to be able to answer that question. So I'm sorry that we won't be able to give you a definitive answer or answer that question here tonight. But I don't want to ignore it. I know that.
One thing that we are allowed to say, and we can say, is at the moment there is at least a 66-week wait to be invited to see the surgeon. So that's
for a 4-slot, or
yep, that's for a 4-slot
appointment. Okay.
Yeah. So and that is all the information that we can give you at the moment. So yeah, we're doing our best to reduce that. We have 7 surgeons all working as hard as they can within the constraints of the NHS service at the moment. But yes, we are very busy. There is a long waiting list.
So what was that number again, Chris? How many weeks?
66.
66. Okay. Thank you. I'll just put a message on the Facebook group just so that anybody who's missed sees it as well. Okay, so the first question I can see is a question I've never seen before, Chris. So I'm just wondering what will happen with my journey as I have no teeth. So is that going to make a difference to somebody's kind of nutrition pre and post surgery?
Absolutely, yes. Yeah, it doesn't stop you having surgery, but it is something for you to consider. So a lot of patients that we've had that have no teeth, or they use dentures that don't fit anymore. So they might fit when you have surgery, but because of the changes, they might not do, and you might be waiting months for a replacement. Then yes, it does affect your food intake. So you might be left on a softer diet. So if you can't chew some of those more challenging textures, you might have to choose the more softer options, and that again will have an impact on your portion size. So you might end up having a slightly bigger portion size because you can eat more of it. So you've just got to be mindful of that. So yes, it doesn't stop you from having surgery, but it is an important factor. So take into consideration that you might not get the weight loss that you want because you're going to be stuck on soft options and you can eat more of them.
Thank you. So the next question is, if somebody has non-alcoholic fatty liver disease, would this affect the liver reduction diet?
Nope. So you can carry on with the liver reduction diet as it is. We often see that there is still some kind of fat around the liver, so you can lose all you can do is lose as much weight as you can. So the weight loss will come from within the liver cells itself. They will shrink, and it moves that left lobe of the liver out of the way. So there might still be some fatty infiltration of the liver, and there's not a massive amount that you can do about that in the 2 weeks that you're going to be on the liver reduction diet. That will hopefully improve with time and further weight loss. And also you're going to have body fat loss around your stomach, and that's what they're concerned about also. So it's just making the operation easier. So they've got to go in with the trocars, with the instruments, and if you've got quite a lot of abdominal fat, it's hard to move them around. So you're not just reducing the size of your liver, you're also reducing the size of the abdominal fat around it.
Thank you. So this next question is about post-op. So one of our attendees today said they're almost a year post-op and have terrible problems in the bathroom. Is there anything that they can be doing to help?
It depends what the problems are. So yeah, there are common symptoms after surgery. Things like diarrhea can be one of them, but also equally constipation can be just as problematic, and it can fluctuate between the two. So constipation often is a result of not enough fiber, not enough fluid, and potentially iron supplements as well. So it's about managing your fiber, your fluid, and your iron supplements, and using laxatives as needed. But hopefully, we want to get you off laxatives in the longer term. If the issues are with diarrhea, it can be due to dumping syndrome. It can be due to a high-fat diet, because that can cause it. It can be due to IBS, as can the constipation, but also can be due to medication. So it just sounds like you need to have a bit of a review with one of the team, either myself or Jodie, the nurse, or one of the medics potentially. And if you've got ongoing problems, then yeah, definitely seek some support.
Thank you. So somebody else has said, I don't have a gallbladder. Does this make a difference to the diet and surgery?
No.
Nothing at all. Nice, easy answer.
Mm-hmm.
Can diverticulitis stop you from having surgery?
No.
Nice, easy answers. Quick answers.
No. Yeah, no, yeah, I don't really need to elaborate on those ones. I think, yeah, the diverticulitis won't stop you having surgery. It's further down the colon, so it shouldn't prevent you having any type of surgery. There are some kind of bowel issues that would prevent you having certain operations. So they might not want you to have a gastric bypass if you have some inflammatory bowel disease. You might end up having a sleeve with that. So there are certain occasions where you can't offer a bypass with certain bowel conditions. Everybody's very, very different, and you need a full-on surgical review to give you that definitive answer. So again, it depends on how far advanced your disease, if you have any other complications, if you ever had surgery, etc., etc. So you do need that surgical review.
Thanks, Chris. So next question's from Louise. It says she's heard that hair loss can be a big problem following surgery. Are there any ways to avoid this? Any supplements, anything like that you would recommend?
Yeah, so we see maybe 1 in 10, so 10% of patients losing some hair after surgery. And first thing I would say is the majority of it is due to the stress response of the operation. So you've just had a major metabolic surgery. Your calorie intake is slashed dramatically, lots of different hormones flying around, and yeah, it's a metabolic stress situation. So that's why the majority of people lose their hair. All you can do really is make sure that you hit your protein target, you take your supplements, that we've prescribed you, and you drink plenty of fluid, and try not to worry about it because that can make it worse. We used to put patients on zinc and selenium supplements as routine, but we now know that unless there's a clinical deficiency, a diagnosed clinical deficiency with a blood test, the extra zinc and selenium is going to do absolutely nothing. So we don't do that unless there's a proven deficiency in zinc or selenium. Things like biotin and collagen and all these things that you can take from the health food shops, you can take them if you want to. So then you've done all you can in a way to stop or prevent or reduce the hair loss. But there's no evidence to say that they are beneficial. But in terms of hair loss, you might start seeing some extra hair on the brush or a little bit more in the sink. Most people don't end up like myself. You just notice that little bit more coming out and maybe some patches. But yes, most people within the first kind of year to 18 months, they will start to have that hair regrowth as long as you get that protein and you take your supplements and all those kinds of things.
Thank you. Somebody else has asked, is there any risk of completely going off food after surgery?
Yes, yeah. So some patients don't have an appetite at all, and they have to have a bit more of a robotic mentality where they have to eat because it's time to eat. And that can be just as upsetting as having too much of an appetite, having to force yourself to eat because you're not going to get enough nutrition. And it's another reason why, going back to the calorie targets, that I don't like to set them, because those patients are going to be struggling to meet that target, and it's going to be a worry. Yes, there is a risk that some patients go off food altogether, although from experience, it doesn't happen all that often. It can happen, and there are certain situations where there's mechanical things going wrong that can affect it. So if you do have those problems, then do let us know, because we can, put a camera down, have a look. We can do a swallow to see how things are going down and investigate and just give you reassurance that that the operation is as it should be. And if it's not, then we can put it right.
Brilliant. So Paul has said, is the no alcohol for 6 months after surgery as strict as, is it really strict? And what are the repercussions if you do have a drink in that time frame?
No, they're not really strict. I mean, you're all adults at the end of the day, and we just want you to be sensible. The main reason for it really is, one, because it's extra calories, we know that, and it can cause dumping syndrome if it's too sugary, and a lot of it comes with fizz as well. So in those initial stages of weaning, we don't want you to introduce things that are going to make you sick. And again, alcohol, if you have too much of it, it can make you sick from a hangover or having too much. But also it lowers your inhibitions, doesn't it? So you'll probably find that if you have a drink, you're more likely to go for that food that that in other times you can resist. But if you've had a drink, it makes it harder to resist. So when you're going through that kind of weaning and recovery phase, it's not ideal. So that's why we advise and suggest to avoid it for 6 months. Now, some people do choose to include a little bit of alcohol, and they do okay. But the majority of patients, they don't have a desire for it. Funnily enough, they don't want to drink, and if they do, they can only manage a small amount. They can't drink what they did before, so they find it more difficult to incorporate into their lifestyle. So yeah, hope that helps answer that.
Thank you. I'm just trying to look through the questions. Oh, somebody's asked, what is dumping syndrome, and could you elaborate on that, please?
Yep. So dumping syndrome, well, there's kind of multiple different kind of symptoms that you can have from dumping syndrome. So things like dizziness, sweating, shaking, nausea, being sick, having diarrhea, all can be part of dumping syndrome. You can have one of those or all of them or a couple of them. and it differs for every patient. Not everybody gets dumping syndrome, and some people get it really badly. It can happen straight after your meal, and we call that early dumping syndrome, and it can happen later on after a meal, and we call that late dumping syndrome. So basically, early dumping syndrome is where you've had too much food too quickly, undigested, and it gets into your small bowel too quickly. It tends to be with sugary or fatty foods that get into your gut quickly, and your body tries to kind of dilute it, pushes a load of fluid into your gut, and that can end up making you feel sick or have the diarrhea. It also reduces your blood pressure, so you feel a bit dizzy. And there's also other things going on there that we're not entirely clear about the mechanism. If it's kind of a couple of hours after your meal, it's likely to be due to a reactive hypoglycemia. And that means your blood sugar has gone up after your meal quickly, and your body has produced too much insulin, and it's come down. Your blood sugars have come down too much, and then your blood sugars have gone low. So then you end up feeling really kind of faint, and you want to go to bed and sleep it off. So they're the two different types of dumping syndrome, but they are treated from a dietary perspective. So early dumping syndrome, definitely reduce the amount of sugar and reduce the amount of fat that you have, making sure that you follow those good eating habits. So taking very small bites, chewing well, stopping when you're full, because that just slows down the input of food into your gut. So it slows everything down. Also separating you into eating and drinking. Late dumping syndrome can be managed with low GI carbohydrates and kind of a low GI meal, rather than having something that's too sugary that brings your blood sugars up quickly. Having a lower sugar, lower GI meal will help to kind of steady that out a little bit. And when I say low glycemic index, what I mean by that is having something that raises your blood sugars slowly rather than quickly. So a slice of white bread will raise your sugars really quickly. A slice of whole grain seeded bread will raise your blood sugars by the same amount, but over a much longer period of time. So it's going for those lower GI options more often.
Thanks, Chris. Somebody's asked, they've got IBS. Will surgery impact their IBS, and will they still be able to take their medications to manage it?
Yes, you can still take your medications to manage it. That's fine. The amount that you take might change, and it's difficult with IBS. We can't tell whether it's going to make it better or make it worse, and it might actually create it in some cases as well. So we have instances of patients having, things like lactose intolerance, and that can cause IBS type symptoms, and other causes of unknown diarrhea attributed to IBS. So yes, we can't promise that it will make it better, but we can't definitely say it will make it worse either. So it's a case of if you're aware that you have IBS and you're on the treatment for it, is monitoring it and changing the treatment as appropriate with the appropriate advice.
Thank you. So Lucy's asked, when should we be prescribed the vitamins? She had surgery on Monday and she's not yet had a prescription for those vitamins.
So your surgeon will be writing to your doctor. If you have the operation with us at Salford, you're normally given a copy of it to take to your GP. If you have it done at the Oaklands, then your surgeon will write directly to your GP. So within that first 3 weeks of having your operation, when you get a copy of that letter, you go and see your doctor and you arrange to have the prescription made. You then start taking them from week 3. So you don't start taking them straight away. So once you've done a week on the pure aid stage, then you can start to introduce your supplements step by step.
Thank you. There's quite a few questions about smoking. When do people have to quit smoking by? And it might be worth going over what the issues are with people smoking and having surgery.
Yeah, well, good job Jodie's not here, because she will definitely be shouting at you. So we do want you to stop smoking as soon as you can. Basically, the less you smoke, the better, for health reasons, obviously. But in terms of the surgical procedure itself, our surgeons won't operate on you to give you a bypass, if you're a smoker. And we know that smoking it gives a risk of ulceration. So where they bring the small bowel up to the stomach, where they join together there, that's at risk of ulcers, and you're at higher risk of ulcers if you smoke. So we don't operate on anybody that smokes because of our experience of people requiring multiple operations, multiple perforations. So where there's been a hole and people have bled and nearly died in some cases of these perforations because they couldn't stop smoking. I can think of three patients, sadly, that have had these recurrent ulcers that bleed and perforate, and it's not a good story. So yeah, I know Jody shouts at people, but it's for a good reason. We don't like people smoking because it can affect you in a serious way, not just the risk of cancer and health disease and disease. It can cause serious damage to the anastomotic joint. So what we advise is you to stop smoking as soon as you can. If you need to vape, but wean the nicotine. So we don't want you to be on any nicotine. So if it helps to get onto a vape, fine, but then wean off the nicotine and hopefully eventually stop. That's what we would like. So the advice is definitely no smoking for 2 weeks prior to the operation, and ideally not in the long term. And I wouldn't be able to safely say to you safely, you can start smoking again in 6 months, it'll be absolutely fine, because we know that that's just not the case. So yeah, as soon as you can stop for good, please do.
The better. Perfect. There's a few questions around fertility. I'll try and amalgamate them. So somebody has struggled to conceive, and they've got PCOS and endometriosis, and the consultants have said that weight loss would be really beneficial and have advised to have bariatric surgery. Okay. Then in addition to that, somebody else has asked, would there be any complications or issues conceiving post bariatric surgery?
Not from our experience, though. It's much the other way. So patients that have previously been unable to conceive naturally sometimes get caught out, and so that the fertility improves with weight loss quite quickly. So we always advise the use of contraception, effective contraception, whether that's a coil or from condoms. We just don't know the absorption of any pills. So we advise that for the first 12 months. Just so people don't get caught out, get unexpectedly pregnant. We do ask patients to wait for 12 to 18 months before trying for pregnancy, just so that you're not in a catabolic state, so you're not losing weight really quickly, you're not kind of showing signs of malnourishment, and also that you've got used to the effects of the operation, so the small portions, the potential for nausea, what you can and can't tolerate. So then if something changes when you're pregnant, you can identify that it's because of the pregnancy rather than due to the surgery, so that you can go to the right people if there's an issue. So yeah, hope that helps answer that question.
Brilliant. So next question then. Is age a barrier for bariatric surgery?
We're not an ageist service, no. So we will accept referrals for patients of any age, but what our job is to make sure that that patient is fit for an operation and that it's in their best interest in the long term. So you can have a 50-year-old that's not fit enough, and you can have a 70-year-old that is. So it's very, very different. So we don't judge patients on age, it's their fitness and readiness for surgery that's going to be lifelong. So yeah, we're not ageist, we just take each case as it comes.
Brilliant. Just to let everybody know, the issue with the survey should be fixed now as well. Okay. Are there any long-term statistics available on people keeping the weight off post-op?
Long-term statistics, I think the longest we have is from the Swedish obesity study, I believe, and yeah, that still shows further down the line. I think they're at 15 years now, that people are at around 50% of excess body weight or total body weight, not excess body weight, but that's just thinking off the top of my head. So yes, there are some long-term data out there, although I can't quite recall it at the moment. from our experience, the majority of people do very well. They lose a good amount of weight, they keep it off. Unfortunately, there are people that do go back into old habits that or pick up new bad habits and do regain weight. But that's why we do these sessions, to warn you that that can happen. The operation just doesn't help you, just do it by itself. You have to put the effort in and make some changes to help you get that long-term success. So if you think, you're doing whatever you're doing now and the operation is just going to magically cure things, it doesn't work like that. You do have to make the effort and make those changes, and eat better and eat more, like we've asked you to.
Thanks, Chris. Can perimenopausal symptoms lead to complications following surgery?
Sorry, say that again.
Can perimenopausal or menopausal symptoms lead to complications following surgery?
Not that I can think of. No, I mean, I haven't. Obviously, there are lots of patients going through those kind of processes after surgery, and I guess it's just dealing with it the best that you can, taking the medications that you've been prescribed, and following the dietary advice. But there's nothing specific that I can think of that would be a problem, for menopause. No.
Somebody's asked, do you have diabetic nurses or do I see my own doctor?
So we do. If you have your operation at Salford, you will see a diabetes specialist nurse before you go home. But the majority of patients, if they have their own diabetes team, you're better under their care, because they're going to look after you for the follow up as well. So yes, we do have access to bariatric specialist nurses, but it's not a routine part of the pathway, especially if you're operating on elsewhere. So yeah, hope that answers the question. So yes, we do have diabetes nurses, but they're not part of the team. Jodie is our bariatric specialist nurse, and is very experienced in kind of the medication side of things, as am I. So you have our support afterwards, and we can liaise with your diabetes specialist nurse, if needed.
Somebody said they can't eat vegetables. How would that affect them after surgery, getting the nutrition that they need?
Yeah, I guess it's going to be no different to now. Where are you getting it from now? So, to make sure that you're eating healthily and properly after surgery, we do want you to be trying to eat some vegetables or some salad or some fruit. Getting the colours and the greens wherever it can come from, whether it's fresh, frozen, tinned, hidden in food. That type of thing, wherever you can. We are going to put you on micronutrient supplements, so there is going to be a minimum amount of nutrition going in there, but definitely trying as much as you can to get them. But there are patients that simply can't tolerate some vegetables, so it's just working with what you can manage rather than what you can't.
Thank you. There's quite a few questions coming through around the 5% weight loss requirement before surgery. So what happens if you can or haven't lost the 5% when it comes to the end of your tier 3 intervention?
Well, we know that this is a requirement from NICE, really, to be referred for bariatric surgery. You have to have this 5% weight loss target. So it's not something that's actually set by our surgical team, it's set by the NICE guidelines. So it is still part of their kind of pathway. But what we would say is if you're struggling to achieve that 5% body weight, it's down to your MDT, so the team that you're working with, to have a frank discussion about what's going on, what are the barriers, and then referring on to us if necessary. What I see more of, though, is patients that have lost a little bit of weight, which is great, it's in the right direction, but then between being referred and seeing us, they've put the weight back on or they've overshot. I've seen that far more frequently, and who can blame them? They've been waiting for over a year, and some cases with support, some cases without, and they put on that weight. So I guess it's just making sure that you make sure that your weight's stable once you've been referred, because that can delay things. If you put on all of the weight that you've lost in your tier 3, then it can delay things even further. They're going to ask you to lose that weight again. So make sure that you keep off what you've lost. Have you got anything else to add to that, Stevie, from your perspective?
I suppose it's just about keeping those open lines of communication with your tier 3 provider. So that might be ABL, that might be More Life, it might be any of the NHS, Trust, Trafford, Wigan and Leigh, that kind of thing. It's about keeping those open lines of communication. If you're struggling or if you're not finding that you're getting the results that you want, keep having the discussions with your coaches or your doctors or your nurses, whoever are in that team. There is no one size fits all for weight loss. And we need to, work with you to do what we can to get you to the point, of being able to be referred. Unfortunately, it is a requirement of commissioning guidance that you do lose that 5%. But everything is taken case by case. So your MDT will discuss every element of your care, your medical conditions, your mobility, everything that kind of has gone along with your journey. But I would say, in my experience, the more contact you have with your coaches, the more success you see, and the more that your coach knows you, the easier it is for them to tell your story at that MDT as well. So I think that's probably what I can get. Saba, do you want to add anything on that question? She's probably busy typing.
Sorry, I was concentrating on typing. Could you repeat the question, please?
So people were just asking, what happens if you don't lose the 5% that you required before being referred for bariatric surgery? So from Chris has just shared from his point of view, and I've just shared kind of what I would say around kind of in touch with your coaches and stuff. I just wondered if you wanted to add anything from More Life's perspective.
Yeah, sorry, I did hear most of what you said. Yeah, the same principle. Keep in touch with the practitioners. So it is a case-by-case basis, and there might be situations where there have been issues. So depending on what the situation is, they'd have to see. But I know that it is a requirement to lose the 5%. So I think that has been stated.
I think an important thing to note, though, is that your teams are going to want to see the effort to change. That's what they're looking for. Whether that really leads to that full 5% or some way towards it. They want to see some improvement in your dietary habits, engagement as well. So go into the sessions regularly, keeping in touch with your coaches and the staff there will kind of be of benefit and in your favor. So the more engagement you have, the better. So yeah, make sure you do keep in touch with them.
Just reading through the questions, there's a whole host and a variety and a mix of different questions. I'm just thinking, whilst you've got Chris here, who's an expert in all things dietetics, do you want to try and ask any questions that are really specific to that pre-diet, post-diet, and any complications that you've heard of, just while we can get, down into the nitty-gritty of kind of Chris's expertise. Again, I'm sorry that I haven't got more answers on waiting lists and that kind of thing. But just while I'm waiting for some more questions to come through, I will just clarify. So when we say tier 3 and tier 4, tier 3 is the weight management service, like myself at ABL or Saba at More Life, that will support you for up a year or sometimes a little bit longer before you're referred to tier 4, which is Salford Royal or Castle Hill, if you're from the Lincolnshire area. So we are your support kind of preparation service, and then the tier 4 providers are where you will actually have the surgery. So let me see. Can you add sugar to tea post-op, or should it be avoided?
I'd advise try it without first. So I went to see somebody just a couple of weeks ago on the ward, and she was in bed with her husband present, and I went to make her a cup of tea because she'd not had one yet. So she drank her water in the morning. She was doing great with that, all going down fine. So I went to make her a cup of tea, and I put it at the side of her on the side of her bed. And before I could say anything, the husband had put a spoonful of sweetener in it and was stirring it. And I said, "Oh, I wouldn't have done that just yet." And I explained why, and she took one sip and said, "No, I can't drink that. It's too sweet." So I went and had to go and make her another cup of tea. So I put that on my timesheet. Yeah, I made her another cup of tea, and it went down much easier without. So my advice would be try it without first. We want to get you off the sugar. We want to get you off the sweeteners. So try it without first. If it's something that you've always done and you're a creature of habit, try and break these habits early. It's the same thing with not eating breakfast. And the person that doesn't eat breakfast, please try and break those habits early, because you're not going to get enough nutrition through the day if you don't do that. It's the same with sugar. If you don't try and break those habits, it's not gonna leave you. So please try without.
Which foods will keep you fuller for longer, Chris?
More challenging solid textures, so anything with fiber, so whether that comes from fibrous proteins or fiber from things like your fruits and vegetables, and kind of carbohydrates with the like potatoes with the skin, whole grains with seeds and things like that. They're all going to kind of keep you feeling full for that little bit longer. So we know that anything that's too soft or too sloppy, or what we call slider foods, so crisps and biscuits and chocolate, when you chew them down, or even crackers, when you chew them down, they go through your operation really quickly. They don't make you feel full. They make you feel, you'll be hungry quite soon afterwards, because they've gone straight down into your small intestine. And it's these kind of foods that can cause dumping syndrome. So trying to minimize that. But other things like wafer crackers and things like that go down nice and easy, we want you to avoid that. We want you to go for the more solid, challenging, crunchy textures, and that's what's going to help you feel full. But also having the right balance at your meal times, and trying to get through a good variety of food at your meal times will help to keep you feeling full and satisfied for as long as possible. Another thing to say is don't be afraid of being hungry. It's okay to be hungry, and don't expect that the operation is going to take away your hunger altogether. Yes, in a lot of cases, it reduces your hunger. In some cases, it takes it away altogether. And like we had talked about before, we have to eat robotically to remind people to eat. But in some cases, the hunger is still there. It's just what you do with it. So if you're somebody that's hungry, within an hour or two of having something to eat, that's fine. It's what you do with it next. So do you give in and go to the slider options that are going to, make you feel not satisfied and potentially lead to weight regain, or do you go for the more challenging textured snack that's going to help you with your weight loss goals and also keep you feeling a little bit more full until your next meal? So don't be afraid of hunger. It's just how you react to it and how you treat it.
Is there anything that people absolutely cannot eat?
Just anything that doesn't agree with you, basically. So no, there's no hard and fast rules of you can't eat this, you can't eat that. I've had patients that come from they've had operations abroad and they've been told not to eat lettuce or stringy vegetables or this and that, and you can kind of see why, because it's a problem for some patients. But that's the thing, you don't know if you're that some patient until you try it. So I wouldn't say there's any food that you cannot have. I would like you to try majority of foods and just see which ones work for you and which don't. And if they don't work for you, then try them again. And if they don't work for you again, then maybe it's something that you need to avoid in the long term. But that's specific to everybody. But overall, the picture is of one of healthy eating. So you still can have those treats if you want to, but it's going to be a small amount occasionally. So yes, if you're kind of alluding to having chocolates and crisps and things like that, you can do, but it's got to be as part of a healthy, balanced diet. So do enjoy your food, have a bit of a treat every now and again. That's fine. You're not a robot. You're not training to be like a beach model or something. You're still going to have a normal life. So do kind of allow that, but not the majority of time.
Is there any limit on the amount of caffeine somebody should be consuming post-surgery?
Just within the sensible guidelines, really. So a couple of coffees per day would be absolutely fine. Any more than that, you can have issues with sleep and anxiety. It can also lead to, loose stools and things like that. So trying to have a limited amount of caffeine for everybody is beneficial. So a small amount is okay. Having too much is probably going to have a detrimental effect in the long term. So just keeping it to sensible portions is fine. But no, I'm not somebody that preaches to not have any caffeine. certainly want you to have caffeine if you were coming to see us. I don't want you being grumpy, so it's fine.
Well, I'm definitely grumpy if I don't have my morning coffee.
Yeah.
Have you got any real life stories that have found people's taste buds changing?
Absolutely. I've already told one of them. So that lady that couldn't take the sweet tea, definitely taste change straight away. She could not handle it whatsoever. And most common things are things that you will already like now. So things like tea and coffee. So quite frequently, people will call themselves a tea belly. So they drink tea all the time, and afterwards they just can't touch it. People might drink gallons and gallons of water, but afterwards they really struggle to get it down without some cordial in it. Some people really have a sweet tooth and go off sweets afterwards and have more of a savory tooth. So that happens more often than you would think. Specific kind of real life stories they happen all the time, definitely. So just be aware that it can happen. And they're the types of things, most often it's what you really enjoy, you end up going off afterwards, which can be a good thing in some cases, but not in others.
A question that I think is always a good one to answer. Can I have a full cup of tea after surgery?
A full cup of tea might take you a while. Yeah, it might take you a while to drink it. And you might need to keep putting in the microwave to keep it warm. So yes, in theory, you can drink a full cup of tea, but it just might stretch out a little bit. Eventually, after a few months or years, you might be able to drink a full cup and not have much problem with it. But certainly in the initial stages, you're probably talking about half a cup before it goes cold, and then you have to reheat it or make another one.
Yeah. Right, I'll pick one more out and then we'll leave it there, Chris, if you're all right with that.
Okay.
So let's try and make it a good one. I'll pick one I've not seen before.
Okay.
I enjoy spicy foods. Will I still be able to eat them in the same way as I did beforehand with surgery?
Fingers crossed. Spice shouldn't have too much part to play. Simply, reducing the size of your stomach is not going to affect the way it kind of handles spice. What it can do, though, is give you reflux. And if it does give you reflux, then obviously we'd suggest to avoid it. They can give IBS symptoms as well. So if that happens, again, suggest to avoid it or have less spicy foods, go for a milder option rather than hotter version. So yes, you can still include spice. In the initial stages, I would suggest just have it in small amounts, nothing too hot. Don't kind of blow your head off and make yourself sick. We don't want you to irritate your stomach in those early stages. So a small amount of spice is okay. In the long term, you should be able to eat, fairly spicy foods without much kind of issue, as long as it doesn't give you any problems of reflux and heartburn, things like that. So yeah, I hope that answers that question.
Perfect. So in terms of attendance and recording that, there's a satisfaction survey that needs to be filled in to record your attendance. So I've popped that in the chat. You should also get it through when the screen closes today. So if you can't access it from the chat, it should come through there, and it should come through in an email afterwards as well. Thank you so much for all the questions. That's been really great. And thanks for participating. Chris, you've answered very many questions there. So thanks for taking the time to do that.
That's okay. Pleasure.
The recording will be saved and posted on the YouTube channel, which I've also put a link in the chat to. And if you follow the Facebook support group, there's individual chats for either Salford Royal patients and for Castle Hill patients, where you can get peer support from kind of like-minded people that are on the same journey as you. There's also lots of people that have had surgery and that are sharing their journeys on there, so it might be really helpful to talk to them as well. I know lots of the patients that we've seen up until this point are really happy to share what they've experienced, and it's not just the flowers and joyful parts. They are sharing the true kind of experience, lots about kind of post when they wake up, the kind of pain from the kind of trapped wind they've got, that kind of thing. So it is really useful to look at. So again, the link's in the chat. But we will see you next month on the first Wednesday in December. And then just so you're all aware, there's never a session in January. The next session after December will be the first Wednesday in February. Those sessions aren't live yet, so don't worry that there's only one session left showing on your emails that are coming through. In December, myself and Abby will update those, and they'll all be updated for you, so you don't need to sign up or join again. But otherwise, have a lovely evening. Thanks for your time, and Saba, thanks for your time as well. Have a lovely night, everyone.